Welcome to another episode of our podcast series, Health Frontiers Insights from Global Experts. In this episode, Voices of Women in Healthcare, we will dwell into the experiences of our honorable guest, Dr. Manjushri Sharma, ma'am, who is an assistant professor of hospital management at PU with a distinguished career spanning various senior management roles in healthcare. Welcome, ma'am. So, ma'am, my first question to you is can you share your journey from working as a medical officer in Haryana, State Medical Service, to holding senior management positions in corporate hospitals and now being an assistant professor at PU? And how has your experience shaped your perspective to women in leadership roles in healthcare?
A tough one, a tough question, and I might have to reveal some secrets here. See, I think I was born and cut out to be a clinician. I worked in government sector for 13 years, but having worked there, I came to know a lot about the challenges that our public health system faces. And I also came to know that we clinicians are not taught in a way where we can take up the challenges that come up, stockouts, medicines not being available, or there being not being enough staff, we being not trained how to handle a bad message, how to handle a death. So there were so many things, and all through these 13 years, I always used to feel that had I been having some management in knowledge, administrative knowledge, this would have helped me be a better healthcare provider, not just a clinician, but a healthcare provider. And that prompted me to go in for masters in hospital management. Once I did that, I thought I would be much suited for corporate hospitals because public health at that time did not have a position for administrators. So I went in to join private care. But there, my husband is a cardiologist, and we now had two kings in the house. That kingdom was not working well. So I decided to become the queen and spend the money he was earning. And that made me go for a position where I can use both my management knowledge as well as healthcare knowledge. And what better place than academia? So Punjab University at that time was looking for a faculty member for managing the MBA hospital management program. I was lucky to be there. And after joining, I did my PhD in health economics, which I really loved. And now, having all these three experiences, I am able to, one, produce good human resource, the students who have enough knowledge to apply their healthcare experiences into their hospitals. Plus, I'm able to bring in more research that comes up with applicative solutions, how to handle supply chain crunch or total quality management issues or management information system issues. And I hope I can spread this knowledge through my students.
Well said.
Thank you.
What specific challenges have you faced as a woman in leadership positions within the healthcare sector, and how have you overcome those obstacles to succeed in your role?
This is a very sensitive issue, especially in our country. My experience says that people tend to take women for emotional and passion roles only. They would not accept you where they feel that a strategic thinking is involved. They would downplay our importance, and they would give us the side roles and not the main role. But there is one thing I have seen, my experience shows that if you are persistent enough and insistent enough and loud enough, you do get your position.
I
So
hope
this is
the
my
girls are hearing it.
yes, this is my message to all the girls and women. So, time to come out of our self imposed capsules and that glass ceiling. And as I said, be loud, of course, not rude, but be loud, and you will get the respect which you deserve.
Given your expertise in communication skills, How important do you think effective communication is for women in leadership, and what strategies do you recommend for improving these skills?
See, communication is an important asset to both men and women. So, but women are, I believe, I'm sorry if I'm seeming to be biased, but I think women have this natural flair for being better communicators.
No, that's very true.
uh, Especially in healthcare, where we have to handle all kinds of situations, especially when I take lectures for communication, I want my healthcare workers to be prepared for both the sides, to convey a good message as well as to convey a bad message. And I am seeing that our medical books don't prepare us for this.
True, very
So,
true.
and we need more sessions and public health development programs like this, where we are able to uh, prepare our healthcare workers, because what is happening is that the medical model is moving from the paternalistic model, where people used to think doctors are God,
Yes.
and so we do not question them. From paternalistic model, it has become now individual.
Yes,
So we
true.
have to handle their issues. We have to tell them what has to be done, what has not to be done, and we have to handle the employees also. So motivational interviewing is one that is going to work now. No more information advice approach. It's now motivational interviewing.
And ma'am, what steps do you believe healthcare organizations should take to promote gender equality and support more women in attaining leadership positions?
I believe the central answer to this, which I usually practice in my class also, is to one, empower them, that whatever decisions they take, be it right or wrong, empower them to own these decisions. And second, just don't go by the flow and by the statistics. Don't go. You are also a young uh, healthcare entrepreneur, I would say, because you are a management student. So don't go by a statistic that women are usually not able to make their mark. Believe that you will be able to. So what I usually tell them is that engage in a positive communication always, look for positive role models, and empower yourself. And for that, not only financially empower yourself, but mentally empower yourself. Keep telling yourself you're the best, you're the greatest, and you can do it.
That
Thank you.
was very, very enlightening, being a management student and a woman. Thank
Thank
you
you.
so much, ma'am. Ma'am, if you have a special message for our women audience, we'd like you to please say.
uh, this message goes to all the women, and from healthcare and not from healthcare. Women have been traditionally wired to believe that we are to be supported and somebody has to take care of us. Uh, it's not that. We are the caregivers, we are the supporters, we produce life. So empower yourself, think positive, and the cosmos takes that message from you. The cosmos will work, and the cosmos is going to conspire to make you the leader. So believe in yourself. Thank you.
Thank you, ma'am. That was very
Thank
motivational,
you.
very inspiring. Thank you so much. And to our listeners, thank you for tuning in today's episode. Until next time, stay healthy, stay informed.